Good evening, everyone. This is Lori from Whole Health Now, and I'm here to welcome you to our 1-hour sneak peek webinar with Dr. Iris Bell. Before I introduce her, I want to talk for just a minute about our terrific conference coming up in April in the Washington, D.C. area. If you haven't already had a chance to look at the Joint American Homeopathic Conference information at the National Center for Homeopathy website, please do so. That's what's on your screen right now. This really is an outstanding conference for all of us in homeopathy. Certainly over the span of my career, this is the most important conference that we have planned. We're really looking forward to the dual combination of seeing about cured clinical cases and learning about current and some historical research efforts in homeopathy. The two of those things together really combine to give us all the opportunity to learn more about our discipline and to go home with a deeper understanding and stronger roots in the knowledge that we stand in the most scientific discipline in alternative healthcare, to be sure. Possibly all of healthcare. But then you guys already know which side of that line I'm on. So I just want to encourage you all to take a look at the conference information. If you haven't already made your reservations, please do so. Take a friend, take all your friends. It's an event that's not to be missed. And this evening, I have the privilege of introducing Dr. Iris Bell, a preeminent researcher in our field. She has been an award-winning researcher in holistic, complementary, and alternative medicine for more than 30 years. She's currently the professor of family and community medicine. She has also served on the faculties at Harvard Medical School, the University of California, San Francisco, the University of Arizona. She's licensed to practice conventional medicine in both Arizona and California. Beyond that, she's nationally certified in biofeedback, a fellow of the American College of Nutrition, a licensed physician in homeopathy and integrative medicine in Arizona. And somehow, even after I've gone through all of those qualifications, I think I haven't mentioned her primary area of study, at least, which was psychiatry. And of course, she's published scores of important information. I want to mention a recent book, Getting Whole, Getting Well, Healing Holistically from Chronic Illness. That speaks to one of the things that Dr. Bell is passionate about, teaching people with a chronic illness to find their own journey home to themselves and to better health. It's something I think we could all benefit from. And while I could go on and on about her award-winning status and work, you all really joined the webinar tonight to listen to Dr. Bell. So I'm going to turn it over to Dr. Bell and make her the presenter this evening. So in a minute or two, you're going to start to see Dr. Bell's screen and hear what she has to tell us about her most current research information, which I'm scared to even say. Understanding healing in homeopathy from a nonlinear dynamical systems model. I'm just a homeopath. Please don't ask me to explain what that means. But I know Dr. Bell is going to give us all the information.
Thank you very much, Lori. Can you hear me okay?
I can hear you fine, and I don't have a single person telling me that they're having any trouble hearing you, so I think we are in good shape. But I'm not seeing, well, I'm just seeing your go to webinar screen.
Okay, so let me then figure out which screen. Okay. Let's see if that works. You should
Yes,
see the title slide now.
I do.
Okay, good. Well, thank you again for inviting me, and I'm looking forward to the conference. I'm expecting to learn an enormous amount while I'm there, and actually even surprised myself with some of the discoveries I've made recently in the literature by really trying to go in more depth into some of the basic science research on homeopathy and areas that probably turn out to be very related to it. And so what I'm going to give you tonight is a short version of my 2-hour workshop that I'll be doing in April. And I'll be glad to take questions. It would probably be easier for me to take them at the end of the talk, but if someone is really confused or needs a point of clarification, then type your question in and Laura will let me know, and I can address that, because I'm happy to try and explain this as best as possible. So what we're going to talk about tonight is actually what I, in simple terms, call an interdisciplinary model for how homeopathic remedies act. And the point of it is to really put together literatures that have never been completely assembled in one place, and try and see, can we outline a whole model for what might be going on with homeopathy and take into consideration all of the research data that exists in the field, or not all of it, but a good deal of it, where there are these odd observations here, there, and everywhere that I just keep registering in the back of my mind, realizing we have to explain that, we have to explain that. And I think this model is in a position to get us started on the road to be able to do that. I don't at all offer it as the ultimate or final answer. In fact, in good science, you put out the model and then you test it, and then you modify it as you need to. I started out really pursuing this recently because of several different convergent things that were going on in my work, where I'm always back, even when I'm writing a paper about homeopathy that has nothing to do with the basic science, I'm always back, if I try and get it to a journal that's outside of complementary medicine, defending the field, saying that it is plausible and trying to figure out, how do I explain that? And so I went back into the literature in more depth recently. And let me see here. I have to get over on this screen, I believe, in order. There we go. And I will go down one more and show you the classic cartoon, which is two scientists standing in front of a blackboard with all kinds of fancy equations, and in the middle of the process with their equations on either side, they have the words, then a miracle occurs, which at some level is the way we look at homeopathy all the time. And it's always appropriate in a clinical situation to want miracles, expect them, and hope for the maximum healing. But in the meantime, our skeptics and our critics are really honing in on this miracle business, and they're making fun of us. I don't think it's necessary for us to deal with that, frankly, because I think there's a lot of science that gives us a foundation that we can build on, and we can start addressing some of these skeptics with more appropriately relevant research to address their issues. So this is not a very simple name for this model, but it's what the different pieces are in broad scope. First, nanoparticles, then hormesis, and what its relationship is to the stress response. And the fact that we as people, as any living system, like a person or an animal or a plant, we are complex adaptive systems. And there are implications of all of those statements for how homeopathy might work. If you look at the diagram I have here, the first is, we're going to talk about this in more depth, but the first is the relatively recent discovery by a research group in India that homeopathic remedies actually retain a material source of the original substance. You know, they particularly studied metal remedies, everything from iron to zinc to gold and silver and so on, as I recall. And they found nanoparticles. And we'll talk about what those are in just a minute. Now, in this model, what we're saying is these nanoparticles are very small, and we're using them in very small dose. So the critical question is, how could that stimulate such an enormous reaction in the person that they would go on to heal, over on this side on the right? It turns out that there are several literatures, two in particular I'm going to focus on here, that talk about the amplification in what we refer to scientifically as the host, which is really the organism, the person, the animal, whatever, the recipient of the treatment, and the fact that it's the recipient making adjustments in the body that amplify the response to the treatment. And so you get what's called nonlinear responses, which is a much bigger response than seems to be justified by the stimulus that came in. If you can think about it in the standpoint just psychologically, if somebody says a word to you, that word by itself has no physical meaning. But if it has tremendous negative meaning for you, you may get angry or sad or one way or another be very hurt. And what's happened is you've heard a word. And the word has meaning to you, and that meaning has triggered this very large response, which I guarantee to you will be associated with physical changes in your body that are not necessarily good for you. Things like more inflammatory changes and blood pressure going up, heart rate going up, and so on and so forth. Well, what happens if you can actually modulate that response, if you can use the adaptation to that reaction to become stronger against the next time somebody tries to insult you or upset you with a word? That's basically what we're saying is going on here. That's really what happens in what's called hormesis. And we'll talk about that a little bit more in a few minutes. And with this whole process, the system strengthens itself by having basically reacted to the original stimulus that the remedy may have brought into the system. And so what you end up with is the system being more resilient to stress. That's the basic idea of the model. Now let's go into some of the details. So two very simple questions that could occupy us for many generations. What's a homeopathic remedy, and what's a human being? Now, for purposes of the science I'm talking about here, we can boil this down to things that are much more boring than what philosophers and people in the arts might say. But I believe at this point that what homeopathic remedies are nanoparticles of the source material in what's called a colloidal solution. And again, I'll explain that more in a minute. And that the human being, as I talked about, is a complex adaptive system or network of interconnected parts. When you think about that fancy word, think about acupuncture, the meridians and the acupuncture points. That's a network within the system. And you know that you can needle a point somewhere else on the body and even send signals up to the brain that are not just pain signals, but actually regulate particular functions throughout the person. That's what a network is all about. It's interconnected, interrelated, interactive. So let's talk about the remedies. The first thing to think about is that what do I mean when I say nano? I used to think every time I heard the term, and I think I first heard it actually from Dana Ullman a number of years ago, that it was a cute way of saying small. Well, it's actually a scientific term for a nanometer, which is 10 to the minus 9th meters. And if you look at this set of diagrams, you begin to get an appreciation of how small that really is. 100 nanometers, and this is all relatively speaking, are down here at this little dot at the very bottom. That's 100 nanometers, and that's the actual upper limit of what a lot of researchers in the nanomaterials science world consider eligible to be a nanoparticle. So we're talking very small. What kinds of things are in that range? Well, think about this as we go through the talk. Viruses are actually in that range, and things below that, actually, all the way down to combustion exhaust particles, which are very small, around 20 nanometers, and so on, all the way down to an atom, which is considered a tenth of a nanometer. So, and believe it or not, there's actually a journal called Small, which I found very entertaining and very encouraging, because that might be our correct place in the world. Okay, so we've established that we're talking pretty small compared with the size of a whole cell. This is a rat blood cell, I believe, and you can see that a nanometer is literally a drop in the ocean of the cell. Okay, what are nanoparticles? Well, those are materials which are very small. That at least one dimension of the particle is is at least a nanometer, and no larger than 100 nanometers in size. And there are all kinds of them. There are some that are actually manufactured technologically in order to create various products and films and so on in industry. They also use nanoparticles to deliver drugs, interestingly, and to do it in a way that gets them in a more targeted way to the precise cell that they want them in, for example, with a cancer cell. There are, though, in the environment, lots of nanoparticles that are called free nanoparticles that just sort of bounce around. They're in things like air pollution from car exhaust or smoke. And you can see in this diagram that you have a sort of dispersed kind of picture here with the nanoparticles are sitting in solution. They're not dissolving further. They're all over the solution, and they may or may not be equally distributed. For the most part, they probably are not equally distributed. And they can clump together, become clusters or agglomerates or other aggregates, whatever you might say. These are pictures using very sensitive microscopy, I believe. My guess is some form of electron microscopy that visualizes these nanoparticles. So you can imagine how large an actual magnification effect you have to have. And I just wanted to point out the thing that looks like a kind of pasta is actually silicon or silica. So that was interesting to me. I don't know what that will mean eventually, but I think it's interesting, as we'll talk about again in a minute. And I think this one over here in the bottom left is gold. This one in the middle here is silver, and so on and so forth. So these are not pictures of homeopathic remedies. These are pictures of what scientists doing nanoparticle research have found. However, it turns out that a group of researchers in India published a paper in the journal Homeopathy a couple of years ago demonstrating that even at high potencies, at 30C or 200C, they could actually demonstrate that there were nanoparticles of the original source that they could identify with very sensitive measures. So they could confirm that it was from that particular original substance. And those persist even at high dilution. This is a very exciting finding because of the constant argument of the skeptics that there's a problem with the Avogadro's number, and that as we keep on doing our dilutions in homeopathic remedy manufacturing, we run out of any molecules. And so there's an argument that we are just giving placebos. And there seems to be an inability to deal with the fact that empirical data in lots of different ways does not go along with that conclusion. The empirical data shows that these remedies act biologically, that they have physical and chemical properties. But for some reason, the skeptics feel the need to continue to ignore the data that say their assumption of implausibility needs to be questioned. Now that we have the nanoparticle finding, we need to take a much closer look at the nanoparticle literature, because it turns out to be very interesting and potentially help us understand what goes on when we use remedies. So in this diagram, this is some supplemental material from that same study. It just shows you that for zinc metallicum, and these were 2 different homeopathic manufacturers in India whose remedies were studied, that the size of the nanoparticles peaked around 5 to 10 nanometers. So we're still talking about very, very small, but definitely in that range. And they had that kind of finding for most of the different remedies, and I think they did about half a dozen of them, all metal-based because they didn't want to have contaminants in their first study, so they wanted to stick with just the metal remedies. But of course, we use these remedies in homeopathic treatment, and so essentially, what might be known about, for example, a metal-based nanoparticle in the mainstream science literature may be quite relevant to what's going on with homeopathic nanoparticles, although my best guess is that the way we manufacture them is much more irregular and probably inconsistent. And after I talk, I think you may see, I'm beginning to wonder if the reason why many clinicians feel that one company works better for them than another, or one potency works better for them than another, may actually be the kind of crystals that have been generated of these nanoparticles. Now, there's a very nice, very, very long review of what nanoparticles do in the world and what their properties are that I have cited up here from 2007. Listen to some of these things in terms of what do we treat and what do we know about the remedies. So in the first situation, these things are small, actually, because of their size, around virus size. They have very easy entry into the body. They go right through membranes. Nothing blocks them. They can get through oral mucosa, the mouth, the nose, olfactory mucosa, or the skin. And then they translocate by way of the blood and the lymph throughout the body. And this has been demonstrated in both animal and plant organisms. So we're talking about something where, yes, indeed, you can administer it all these different routes, and yes, indeed, it can get all over the body pretty quickly. Now, nanoparticles are not necessarily health-promoting things. I think you'll see that the theme, in one sense, of this talk is in the real world of biology, these kinds of things have a real double-edged sword to them. You have both a benefit potentially for some of them, and you actually have great toxicity from others. And so some researchers are now pursuing nanotoxic particles as part of the cause in a lot of different diseases, including autoimmune diseases, Alzheimer's, Parkinson's, Crohn's, and some cancers. And you can imagine from some of the pollution that these things get into the body and may be able to do potentially a lot of damage at higher amounts. The allopaths also right now are doing a lot of work using what they hope are benign nanoparticles as drug delivery vehicles, as I mentioned, to target tumor cells or infectious organisms like HIV. But what they found is that the nanoparticle, because of its ability to just bounce right through, not bounce, but to actually pass right through membranes and so on, it carries the drug into the target cell at much lower dose. I've even seen studies in the literature where this was done with hypericum and with gelsemium, but more in herbal form. So keep in mind when you start thinking about this, the distinction between a higher dose of something and a lower dose of something, because clearly homeopathy spends most of its time and its therapeutic benefit working around at the very lower doses. And that's going to turn out to be, I think, very, very important. So what are the properties of nanoparticles? They have a high surface area to volume ratio, and that appears to make them more reactive. The atoms and the electrons that are floating around just are more able to interact with things around them. So as the particle size gets smaller, the nanoparticle actually gets more reactive. And the physical chemical properties of nanoparticles differ from what the scientists in this field call the bulk form, which would be if you had gold, that's the bulk form of the material. And it has, for example, a certain melting temperature, which I have on this slide, of over 1,300 degrees Kelvin. And obviously, gold is considered non-magnetic. But actually, when you study a 3 nanometer nanoparticle of gold, it turns out to have a much lower melting temperature, and it's magnetic. So the properties have completely switched around from whatever might be known about it in bulk form. On top of that, it appears because the atoms are more able to be close to the surface of a nanoparticle, they actually claim to see quantum-like effects. Now, whether that has any direct implication for some of the observations that have been made in homeopathy, we don't know right now. I mean, I'm just noting that this is the only time I've ever read any literature where it looked like perhaps the material that we use could indeed have these kind of quantum effects. And this would be along the lines of what Harold Wallach and others around the homeopathy world have suggested involve quantum entanglement phenomena, where, as you know, in provings, many times the person who gets the placebo may have the symptoms of the verum remedy that's being tested in the proving. And there are many debates and arguments about that, and should we use it, shouldn't we use it. I think that this is a starting point for us to take a look at the question of why are there these bleed-over effects from a verum into a placebo, perhaps literally on the basis of quantum properties of the nanoparticles being used in the study. But again, that's very speculative, and we have a lot of other work to do before we even get there. Another important property is that this can be bottom-up. So you get self-assembly of nanostructures. Once they start laying themselves down, many times because they're so reactive, they will actually assemble structures that just make themselves. It's called self-organization. It's also a property of complex systems. And it's a very interesting phenomenon because you get emergent effects. As the structure starts building itself, properties that you can't really predict from the original building blocks start coming up. Now, overall, the nanoparticles have properties that are mechanically, optically, electrically, and magnetically different from those of the bulk form of the same material. So they're very, very interesting, and I frankly think that's what we're dealing with in homeopathy, largely. I don't think it's the only story, but I think it's an interesting one. Now, this has no direct bearing on homeopathic remedies, but it's a very recent study just published where they were looking at carbon nanotubes of a particular type, and they were testing the question of whether the physical and chemical properties were affected by how much time they sonicated the solution. And what I want to point out to you is that we need studies like this specifically on homeopathic remedies, but sonication is using ultrasound or some sort of mechanical or sound vibration to succuss the remedies is one of the ways some manufacturers use to prepare their materials. And so what the implication here would be is that there may be quite and this is obviously nonlinear, it's not a straight line, but there would be a relationship here in terms of what the nanoparticles, if they were homeopathic remedies like carbon and various other kinds of derivatives of carbon remedies might be, they would have different properties depending on how many times they had been succussed and what kind of total time they had that treatment. In general, it's very likely from the homeopathic research literature that it is the succussion step which really creates these nanoparticles. The dilution is a fascinating and important part of it to get to a low dose and probably to allow enough space in the solution for the nanoparticles to be dispersed. But the succussion is probably what makes it do something and probably the answer to the skeptics' concerns because their primary focus is always the dilution part of the preparation. And so far they have ignored the succussion part. So for example, in the homeopathy literature, a group in Italy a number of years ago now did a whole series of studies which they've replicated over many years, where if they changed the pH, the acid-base balance, extremely in the solution where the remedy was dissolved, so-called, or in there, the 12C potency released much more heat than an ordinary dilution or a dilution that was done in a ratio of 1 to 2. So a ratio of 1 to 1 or 1 to 2, for example, in water, did not have the same effect of releasing heat as the 12C potency of the same material did. And the implication here that they drew was that homeopathic remedies have to be some sort of ordered solution. There has to be some structure in the solution which is being broken apart by the extreme change in the acid-base situation. And that's been a very interesting observation that they repeated, but nobody could really explain, because we're still all have been, until the nanoparticle finding, trying to figure out how to explain it just in terms of the structure of water. And I think this takes us past the structure of water into the structure of the remedy in water. We also want to take a look, and I'm guessing we're going to find more literature on this, on the alcohol ability, because we put alcohol to preserve the remedies, but ethanol is also a stabilizing factor in solutions on various structures. So it probably plays a role unto itself. So what kinds of implications do we have here? Well, that homeopathic remedies are physical entities with unique properties that are probably going to differ from bulk material of the same source. And that because these nanoparticles are dispersed in solution, it's actually more of a colloid. It's not a true solution where the original bulk materials were completely dissolved. It's that little tiny molecules and atoms of the source material are sitting there. For example, something like milk or fog or smoke are actually colloids, because the material is not fully dissolved, it's simply dispersed within the solution in which it sits. And as I said, the succussion is probably what's doing this. It's also true that John Ives and others have been working on finding, well, they found data that the glass walls of the containers that we keep the remedies in while we're preparing them and succussing them, probably those release various trace contaminants, including silica, from the walls of the glass. And it's also an interesting thing that potentially those silica particles could actually break off and themselves become part of the colloid. So you'd have a mixture of the original remedy plus silica. And again, the silica probably in relatively different quantity and form, but it would be there. And the silica is one of the media in the nanoparticle research literature that people use to build these self-assembled structures on top of. So it seems to be a common vehicle in a lot of the research for carrying other substances, other drugs into the system. So the unique properties so far that we're talking about with nanoparticles could help us understand a little bit more about what goes on with homeopathic remedies. Now, as I said, they can be toxic, benign, or beneficial. So we're not talking about something that's just all good. The toxic kind come from car exhaust and a lot of other things. The beneficial kind are certain forms that they found don't seem to damage the cells, and even some that have been found to protect cells from free radical damage. But the effects right now in their world are pretty hard to predict. One size nanoparticle cluster causes one effect, but the next larger size goes in the opposite direction. In fact, the direction of the effect can oscillate up and down as the size of the nanoparticle clusters goes up. So again, this is nonlinear. It's not a straight line. It's not that the more particles you have, the more of a particular direction of effect you get. You're going to be bouncing up and down more like a sine wave. And the important point here right now, and I'll show you a slide in just a second, is that nanostructure matters a lot more than chemical composition. The skeptics are all raving about chemical composition and, you know, gold is gold is gold. And if you read the nanoparticle literature, that's not what the nanoparticle scientists say about their materials. And since homeopathic remedies are nanoparticles, it's extremely likely that we're talking about the same thing in some way or other. So here, for example, is a graph of a particular effect that this was in a test tube of not homeopathic remedy platinum, but platinum nanoparticles. And they were able to specify the actual size of the clusters that you see here along the bottom in the range of 5 to 25, I believe it would be nanometers size. And the open circles, I believe, are the anions. The dark squares here are the cation form. But what's most important here is not specifically what this is, than the fact that as the cluster size went up, as the nanoparticle size got bigger, you didn't have a straight line at all. What you had was, at a certain size, you get a very large effect of its ability to catalyze this reaction, and then it would go back to nothing. And then as you kept going up, it would go back up again, and then back down, and back up, and back down, and so on. So this is very interesting, because it turns out that if you look closely at the basic science in homeopathy, this is the kind of thing you actually see. So this is an old study on plant development, and this is in the homeopathy literature, where they took argentum nitricum in D24, D25, or D26, and those are essentially X potencies, and they used them to work on the development of plants. And what you see there is the effect was bigger on 24X, smaller on 25X, and big again on 26X. Well, what if you start translating your thinking about the remedy into being nanoparticles and understanding that the amounts of succussion are different there, and that may be part of what's underlying these very odd nonlinear graphs that we see? Certainly raises some questions in my mind as a clinician about, well, what potency am I using, and, you know, am I going to get an effect that I expect if I give it 12C? What is a 12C exactly, and is a 12C from this manufacturer going to do the same thing as a 12C from that manufacturer? And that's just looking at the remedy. That's separate from its interaction with the person. So let's start moving towards, okay, it's interacting with the person. Now what do we make of all this? Hormesis is something that people in homeopathy have talked about for a long time, where they've been very interested because it appears to come up with low doses. It is a nonlinear dose-response relationship between a substance and what happens in the organism. And it's usually observed below the toxic threshold. It's actually observed below the no observed adverse effect level threshold. And it's been found in thousands of research studies when people look. But of course, conventional researchers usually don't bother to look because they're working in a different part of the dose-response curve where they're expecting the more they give, the more effect they get. It turns out at these low doses, something very interesting happens. What you see here is a drug that is used, I believe, in breast cancer treatment. This is a test tube kind of study. But what you see is actually that in the very lower doses, this drug actually increases the proliferation of the cancer cells. When it starts getting up in concentration, then it starts killing the cancer cells. And of course, as you get into doses that are used in conventional treatment, you're not in this graph, but you're going to be in the range where you're killing cells. They're never going to realize that the low dose might have actually gone in the opposite direction. Now, it turns out that there's actually even been a review of whether nanoparticles themselves could trigger hormesis. And there are quite a few studies that show that they can. Now, not every nanoparticle seems to do that in those studies, but it is a phenomenon that has been documented. And what people have suggested, researchers, again, certainly not homeopaths, these people have been scared to death of being linked with homeopathy for most of the time. They're slowly beginning to become open to it as they begin to see where the overlaps are. But another hormesis researcher wrote that what it really amounts to is hormesis is a generalized whole organism adaptive epigenetic response, which means basically the organism is adapting to the environment in which it finds itself, and there's an interaction there between its genetic potential and its current state, nutritional state, age, blah, blah, blah. But basically all of those things can feed together, and the hormesis reaction is actually what the organism is up to, not what the original substance is, but what the organism does when it experiences the agent as something that's some sort of a stressor or threat, and it's going to start elaborating a reaction to that. And I thought of the Nietzsche quote, "What does not kill me makes me stronger," at that point, because that's really the essence of what we're talking about. That if you, and at one level maybe it's something like vaccination, where you give a little bit of an attenuated agent, which causes, in that case, the immune system to develop antibodies and to be prepared against a larger onslaught of the same infectious agent if you run into it. But you don't need to involve the immune system exclusively or even at all, although it probably is partly involved. So again, in homeopathy, we want to take a close look at this whole issue. We always say, well, you know, what makes a healthy person sick can make a sick person well. And I haven't seen a whole lot of studies actually looking at that question with homeopathy. This is one of the few I saw in the animal literature, where it was a combination mineral remedy, apparently. And they gave it to rats who had a standardized injury to their paw, where the paw was swollen up with edema. If they gave the remedy before the injury, they ended up with more edema. If they gave the remedy at the time of the injury, they got a little bit more edema. But if they gave the remedy after the injury, they decreased the edema. So they're giving exactly the same homeopathic remedies. It's the timing relative to the injury that actually made the difference. And so again, it's this interaction. It sounds a lot like homeopathy is going to interact with the state of the organism, and it really matters. You know, I know that there are some people who are very interested in homeopathy as a preventive kind of intervention. Right now, at least in theory, with all of what I've read and what I've thought about here, I'm a little worried about considering homeopathy as having very much potential in that area. It's preventive if you have a problem, and it strengthens your resilience to something that might come down the pike. But I don't know that it's something you want to give before you have an injury. So anyway, something to think about, because I know a lot of people pre-treat with arnica before surgery and so on. And I honestly don't know what the literature on arnica, what the findings on arnica would be. I don't believe that's actually been systematically studied. It's been misused in some research studies where it's been given for a very long time before and after, and it definitely made a lot of things worse at different time points. So again, the organism's current state and past history make a difference in the direction of the outcomes. Now, this is not a homeopathic study, but this is a study looking at what happens when you let the organism amplify the response, but you push it as far as you can with multiple pre-treatments. In this case, it was actually a study with cocaine, but this researcher has studied many other agents, including stress itself. But he's looked at infectious agents and cytokines and drugs like Valium or diazepam, and he sees this kind of thing where the organism takes off and does the amplification with changes biologically in the cells that occur if you give the organism time to respond, time to make those adaptive changes. And so what you see in this slide is he gave pre-treatments of cocaine before he would do a test. And the more pre-treatments he did not get a linear response. What he saw was if he had no pretreatment here in the open bar, that's what he saw. But if he had given a previous treatment, then he had an increase the second time he gave it, or when he repeated it. If he'd given 2 pretreatments, though, the size of the response went down below the control. And then it went back up for the third, for the situation where 3 pretreatments had been given, and then back down for 4 pretreatments, and so on and so forth. So again, you see this up and down, up and down. It appears to be a property of organisms that's very interesting. We just recently published a study where we were having people sniff the homeopathic remedy sulfur on 3 different sessions that were spaced 1 week apart, which is the protocol I've used for testing this kind of sensitization or time-dependent sensitization in people. And what you see is that depending on what week a given dilution was given, you got a different size effect on the brain waves. I'm not going to go into this in great depth, but suffice it to say that if a 6C were a 6C were a 6C, you should have seen the same thing happen every time it was given to people. You didn't. And the pattern of the response to different dilutions was affected by what had happened the week before and the week before that. So again, this is in keeping with the notion that the organism is doing something with this information, and it's changing, it's adapting to whatever the remedy information is in different ways as time goes on. So what would it be doing? Well, it turns out that there are several things that could be going on besides the adaptation that I've been emphasizing. One of them, as I mentioned earlier, is it turns out that the group in Italy that first found the extra heat release from homeopathic remedies also found that these remedies may actually increase in their ability to release heat if you stored them for months at a time in small volume solutions. Now think of a cell, that's a pretty small volume. But whether it's in, they've only studied it in the test tube, so we don't know what would be going on in the body. But the remedy actually seemed to be able to generate more heat, which implied that it created more order within the solution by sitting on the shelf in solution, which is a very interesting finding I've always found curious and didn't know how to put together until I realized that nanoparticles could be doing something like that. The other thing, and I'm not going to make any attempt to explain Dr. Montagne's research because he knows much more than I do about his work, is simply that he found that some nanoparticles, at least of bacterial DNA, can emit electromagnetic signals to other nanoparticles, but it tends to be able to send those signals effectively mostly to bacteria of the same species. Think about that if you're picking the simillimum, that at some level we are trying to choose the remedy whose signaling properties to the organism are very salient. They mean something. It's like you've recognized that you have someone in your tribe or species in the form of a remedy that has shown up, but a very small version of it. And the nanoparticles, as I mentioned, they can build structures in their own kind of way by self-assembly. Now, the adaptive responses are probably the more important thing that we're talking about because, again, the skeptics would say, look, sure, you have a nanoparticle, but we're exposed to nanoparticles day in and day out. Nothing happens until we get some disease years later, but it's not like we get immediately some kind of effect the way you do with homeopathy. And the answer to that is, yes, it has to be meaningful. To the organism, it has to be perceived as a signal. This is just a graph showing that finding from the Italian group that the smaller volume around 3 milliliters seemed to be where they generated more heat release when they tested it 400 or 500 days after it had been originally made and just left on the shelf. And when they got up to larger volumes like 200 milliliters, they didn't see that effect. Now this may have something to do with the ability of the nanoparticles to bump into each other and literally start self-assembling some other nanoparticle structures. But again, that's speculative, but it begins to help us understand why would we have that observation with homeopathic remedies. This is just one of the studies on the bacterial DNA sequence I'm not going to go into, but again, the notion that there's some sort of electromagnetic signal that at least the bacterial DNA can send out. Now, do all nanoparticles send out these kinds of signals? I do not know. But as I said, some of them develop magnetic properties that they didn't have. And again, I put that in my back of my mind with the clinical observation that some people claim something like a magnetic resonance scan can antidote remedies. Well, if you have particles that have been reorganizing you as an organism and it gets exposed to an extremely strong magnetic stimulus, it could very well be undoing the information that the remedy had brought in a very direct way. So again, the emphasis here is these are nonlinear dose responses, and the amplification process depends on the organism, not the external agent. It has to be salient, and the key factor has got to be that you've got something going on here with not the chemical but the organism, and it's not specific to the agent unless there is this match between, as we well know, between the organism and the agent. So how could homeopathy be doing this kind of thing, or anything causing hormesis, causing a direction in one study or one experiment where it does it differently in the next, or in one administration of a remedy and differently in the next? In low doses, the agent or the remedy or the nanoparticle is basically a non-specific mild stressor that the organism has recognized. And what it has done then is set in motion these adaptive changes in the biology of the person. What this does ultimately is increase your resilience against higher doses of either that same agent or other stressors that can affect you in the same kind of ballpark. And again, that's what we're looking at in a clinical situation. So I will focus your attention just on the complex adaptive system definition here. But basically, we're talking about a system in which there are multiple parts that have relationships, interact with each other, and self-organize with properties that you can't predict from knowing what the parts do. You may know what a liver and a heart and a lung do, but they're not a person. And the only way you can know what a person is going to be like behaviorally is to have a person in front of you, not a liver. And a complex adaptive system is always responding to changes in its environment, trying to maintain its own internal milieu or homeostasis in spite of being knocked around by what's going on in the environment. And that's really what resilience is being able to bounce back. And living systems like people, animals, and plants are complex adaptive systems. In the complex systems literature, life itself seems to require a very delicate balance, and it's a dynamic one, between too much order and too much chaos in the context of the environment that a system lives. So what happens with complexity when you get sick or when you get older? Well, this is one of many studies, probably hundreds at this point, showing that young people have a lot of resilience. They have a lot of complexity, in this case in, I believe, a heart rate variability signal, whereas older people and people of whatever age who have a condition called congestive heart failure, they have less complexity in their heart rate variability. What that means for them is that their heart is literally less adaptable to a stress that might show up, where an abnormal beat might trigger a serious arrhythmia in an older person or someone with congestive heart failure. it may have no effect at all on a young person who has that kind of variability, this ability to bounce back. So in a real sense, what homeopathy has to be doing if it's making people so robust and well and improving the vital force is you can translate that scientifically into saying it's optimizing or restoring complexity to the system. So, and we talked about this earlier, the idea that complex adaptive systems are networks. We're interconnected just as we are, we know we are in the acupuncture meridians and points. The information is flowing back and forth, and the little toe, in fact, has some information to tell the brain and vice versa. And over here is a diagram from Vithulkas's original book in 1980, where he talked about the pattern of healing, more or less along the lines of Herring's Law, as a person were recovering from a very serious illness that first started with psychiatric problems like phobias and suicidal depression, and then bounced back and forth in the person as a self-organized system or network to neurological symptoms, then irritability, then liver dysfunction, and eventually a skin eruption. This is a hypothetical patient over a period probably of years being treated for a very serious illness. But the notion is, isn't this fascinating that when we give a remedy, the body just doesn't do anything at random. It does things in some sort of interesting pattern where symptoms begin to be emphasized and then de-emphasized, and in a way that makes you think there really is a very significant wisdom to the body, which there really is. So all of this comes together under a term called allostasis, which is the set of biological responses that promote adaptation. And when you start delving into that literature, you find some other more very interesting things. And I know we're going to run over, if that's okay with everyone, because I can see I have quite a few more slides left to talk about. And I'll be happy to stay and answer questions. But basically, there are lots of mediators that we know about: the autonomic nervous system, cortisol, pro and anti-inflammatory cytokines in the immune system, metabolic regulating hormones. Those form a network that respond to stress. And that network actually is probably what's dysregulated when disease has developed. It's something that's been pushed past its limits when it can't get you back to normal anymore. It's called allostatic overload. And this is just a diagram that McEwen and his group have published in a variety of places on the nature of the allostatic nonlinear stress response network. Again, talking about this is not simple, nothing's linear, something doesn't go up and something else go down, and that's the end of the story. These are in balance and regulation of each other, and that's the nature of a living system. It's very complex, and that's part of why trusting the body to heal itself is one of the powerful things about homeopathy. Because trying to force it to do something the way allopathic medicine does is going to imbalance something else, because you can't possibly know all of the downstream implications of fiddling in one area of a complex network. So let me give you an example of, well, are we really dealing with something that probably is complex here? Well, this is a classic graph of what happened when some of the nonlinear dynamics were first discovered in the weather, where Edward Lorenz had run a computer simulation. He ended up doing it 2 times for various reasons, and he found that the simulations of what the weather was going to be doing, the temperature, came out differently as time went by. And he couldn't figure out what was going on until he looked back and found out that in one of his simulations, the computer had rounded off, and in the other, it hadn't. And as time passed, the system projections diverged dramatically. So for example, here, the prediction was the temperature was going to be up, and in here, the prediction was it was going to be down. And yet, when you look at that starting point, to your eye, it looks identical. And it is when rounded, but not if not rounded. So a fraction of a difference in initial conditions affects a complex system.
Welcome to GoToWebinar, Web Events Made Easy.
Whether people who report being chemically intolerant have a different response to.
Welcome to GoToWebinar, Web Events Made Easy.
This group before, and this kind of system using EEG allows us to look at that. And what you see here is that as the sniff cycles kept going on over the course of the sessions we had them sniffing in, the people with chemical intolerance just went off in a different direction with their EEG response to the sniffs than the people who didn't have that problem. So again, the divergence becomes more obvious as time goes by. And this is where they started, so they were very close to each other. In fact, they reversed direction on each other somewhere in the middle of the course of sniffing the remedy over and over. So here's a starting condition, which is a trait of being chemically sensitive, which changed how the response to the remedy looked. So the remedy is basically then acting like an adaptogen. It's acting as if it were in interaction with the individual. And if you're up, it'll push you down. If you're down, it'll push you up. But then it's not that simple, because then whatever it is that it's affecting is part of and embedded in a much more complex network where lots of adjustments are being made in response to the small change that this originally initiated. There's been one person in the world of hormesis who's actually suggested that if you could figure out, especially early in life, how to give a person mild stress with hormetic effects, you might actually change the expression of their genetics and end up with someone who lived longer. And there's actually ways to experimentally test this, which I'm going to talk about in April when we meet in the workshop. But this is a very interesting prediction. It's striking that Hahnemann lived as long as he did in an age when people didn't necessarily live that long. And perhaps it had something to do with testing remedies a lot and giving his body little hits of stress. And of course, he had some large stress from the environment and the way he was treated as well. But it's an interesting model, and it's not completely fleshed out, but it's an interesting way of thinking about how homeopathy might make a person more robust to things that could come up in their life over the course of their whole lifetime. So when homeopathy works well, we believe that one of the first things we see globally is increased energy and an improved sense of well-being. And what I'm postulating here from everything I've told you about is that this global improvement is actually coming from a regulation or an adaptive change in the stress response network that we just talked about. When you do that change, then it takes away the conditions that enable the various symptoms at the local organs to occur. Now, that's not the whole story. I'm not trying to say it explains all of homeopathy. But if you rebalance things, the circumstances are gone, and the local organs, which are connected with the larger global whole and talking with it all the time, may actually simply change what they're capable of doing. There's research in animals over many years showing that you can even you can make an animal susceptible to anaphylactic shock, which is a life-threatening allergic reaction, or take it away just by regulating the way the brain regulates the autonomic nervous system. So this is very plausible and very possible. So what would you do to look at it? You'd want to measure pre- and post-treatment values of things. Resting values may not tell you how resilient an organism is. You've got to perturb the system and then see what happens. You want to see how strongly it's perturbed, and then you want to see how fast it gets back to baseline, because it's not that homeopathy is going to prevent you from being stressed, but it's probably, if it works well, going to make you less reactive to that stress and more able to respond. So here are some questionnaires or some ways of thinking about measuring this resilience issue. One of them is that there's a brand new paper out by Bryan et al. That was, I believe, published in Homeopathy recently, where they actually developed a system for looking for evidence of Hering's law of cure and the change that a patient gets as they're going through treatment. In our older fibromyalgia study, we defined our exceptional responders as people who had good global, who were at the top of the group in global health rating improvement and local pain improvement. So again, this idea, if you're a complex system, you have to be showing both global improvements and local, or your system is not actually making the optimal changes. And finally, if you want to look at least psychological resilience, there's a standardized validated scale. There are probably others as well, but this is one that's been published and in use for a while that will actually allow you to measure resilience. So you can do research to try to look at some of this with simpler things like this. I'm not saying that it's just psychological resilience. When I'm talking about stress and I'm talking about resilience, I'm talking about psychological, biological, and chemical in all those ways, the bad, the stress, and the good, the resilience. And the way we're going to try to look for it is to stress the system. But I want to point out to you from another study that was done in the sensitization literature, if you don't stress the system and you don't try to show what it can do under stress, you may not see anything. And so I'm not going to go in again to the details of this. What I want to emphasize here is that there were some dietary things done. It turns out that sugar cross-sensitizes with amphetamine and cocaine. So take that for what it tells you, but there's quite a bit of research to support that point. It actually affects the same brain chemistry in the reward system. And it turns out that if you cyclically have animals eating sugar with their chow, you actually pre-sensitize them to amphetamine. So if you do this whole thing and you go in cycles, and then on day 29 you give them their first exposure there to amphetamine, you will see that they have a big whopping reaction that appears to occur because they had this previous exposure to sugar. But if down here you give them a saline injection, so you're stressing them with an injection, but you're not stressing them, you're not giving them exposure to amphetamine, you're not playing on exactly the same pathways, you don't see that same reaction. So if you have the person sitting there, you may not see how resilient they are. They may tell you something, it may be true or not true. You may observe something, and that may be quite valid and may be much more valid to observe their behavior than just what you're told or not told. But keep that in mind both for research in homeopathy, in response to homeopathy, and in clinical care. You want to know what happens when stress pushes on the system. So in clinical care, obviously, what this implies is, well, we still have to find the correct simillimum. You're looking for nanoparticles that have properties similar to the properties of the organism as a whole. So that hasn't changed. But it does also imply that we want to be very careful with giving only small doses of these nanoparticles and pulse it in time. In other words, separate the dosing. We've often been taught in clinical training to not repeat the remedy too soon or too often. And I think that's going to turn out to be particularly important if remedies are in fact nanoparticles. And I'd say be prepared to look at different manufacturers' products when you have a patient where you're pretty sure you've got the right remedy and you're not getting the response you thought you would get. And that includes potency. That you don't know what nanoparticles you're working with. This is sort of a Wild West situation right now because certainly no manufacturers look at this question. And we wouldn't know what to do with it if they did right now. We need a lot more research to understand that. But then look again for resilience under stress in biology and psychology in your patients. And I won't go into a lot more detail about this, but there are a number of standardized ways that you can stress the system if you bring them in the lab. Psychological tests, physical tests is simple or as difficult to do as a cardiac stress test on a treadmill. And you can measure the allostatic network. You can look at biomarkers like the autonomic response, the peak response to stress, the time to recovery. You can measure cytokine pro and anti-inflammatory markers, and this has been done in a variety of experimental situations. You can get 24-hour urinary-free cortisol, or you can get spot samples of salivary cortisol before and after a stressor to try to look at this kind of thing systematically. You could give somebody a standardized pain exposure like the cold presser, where you put their hand in a bucket of ice water and see how long they can stand it. Not a very fun thing to do to someone, but it's a way of taking a look at their pain threshold tolerance. So in summary, when a treatment works well, the remedy is probably acting as a non-infectious, virus-sized, virus-like, mild external stressor perceived as a threat of some sort to that organism. And what it's doing then is setting in motion hormesis with the stress response network making adjustments to strengthen the person against this invader. So the next time that person encounters stress of any form, that person's going to be stronger in resisting the health effects, the adverse effects of that stress. So this is really the same thing, so I'm not going to go into this again. And I just want to conclude by acknowledging that I am a consultant to Standard Homeopathic and Highlands in the United States. They did not provide any funding for this particular presentation or for any of the research studies that I've mentioned here. But I'm obliged to do that for full disclosure. So at that point, I will finally stop rattling onward and see what kind of questions we might have.
Thank you so
Lori,
much.
Are you there?
I'm here. Thank you so much for a spectacular presentation. And we do have some questions that came in, and I bet a few more will come in now. One question, which has two parts, I guess. It seems like a couple of ideas that we have bounced around in homeopathy a lot for a long time maybe aren't holding up. And one, oh goodness. Pardon me. One of those ideas is the very idea of Avogadro's number and the math of material particles. And then the other is homeopaths sometimes have taken a sort of a smug kind of position about the immaterial dose, that there's a certain safety in our immaterial dose. And it seems like this look at the research gives us new things to consider on both of those points.
Yes, it does. It certainly brought me up short to see that, not too surprisingly, that the allopaths are particularly concerned about nanoparticles as things that are toxic.
Right.
But then when I stepped back and thought about it for a minute, we don't use even nanoparticles in the quantities that they use them in. So, for example, I can't remember if it was I think it was hypericum, but it might have been gelsemium. When they did that herb study, they found they could get roughly the same effect at 20 milligrams per kilogram if they used nanoparticle as a carrier, but it took 200 milligrams per kilogram if they did it. That's still a very large amount of material. That's nothing like what a homeopathic remedy dose involves.
Right.
So, yeah, I think that it's not, first of all, it's not an immaterial dose when you're below Avogadro's number.
Right.
You can find detectable material in it. Based on what we experience clinically and some of what we know, that they don't last as long. There's actually been a study in animals that showed they don't last as long in lower potency as they do in higher potency, and so on. So there are probably different issues with lower versus higher potency in that sense. But there are probably nanoparticles from the first time something is actually succussed and prepared in a homeopathic way. And then what protects us, I think, from doing a lot of harm is the whole practice model that we use, which is very, very low amounts of very, very small nanoparticles that we don't give constantly. And that's a very different model for dosing someone than allopathic medicine.
Okay, so you're suggesting that the protection that we may have attributed to things like, quote, an immaterial dose really comes from our lighter hand overall.
That's my working hypothesis right now.
Okay. Okay. One of the questions which relates to this context is then, do you have special concerns about no-sodes or sarcodes?
Yes. I thought about that. Again, this is all very new to me as I started to read the literature, and I thought, oops, And again, the issue is, hopefully it's properly prepared. I would certainly hope that people would try not to use super low potencies because I would be concerned about material contaminants that could still be infectious or, some kind of issue one way or the other. I don't know about the nanoparticle versions of the virus. My guess is that you in fact have the same kind of thing as you have with, say, arsenicum.
Right.
I mean, you don't want to take a lot of low-potency arsenicum because you can get enough arsenic to actually get yourself sick. But in a higher potency, you're going to get the benefits from the homeopathic preparation. So my guess is it's more similar to that. It's more like a vaccination with the body capable of doing an adaptive response to the no-sode in the same way it does to any remedy.
Okay. Another question in a different area, but when you were talking about how alcohol in our remedies and certainly silica from the glass bottles we use to prepare remedies may play a part in our remedy action that we haven't really considered. What, if anything, does that say to us about the remedies that are stored in plastic containers?
I'm not sure. I think that's a very good question. It doesn't speak to the method of preparation, and it doesn't actually tell us that you can't prepare a remedy in plastic even. It may just be that it sort of stops any nanoparticles from proliferating, for example, because you don't have some of those other factors as upfront as you would with the alcohol and the silica. I think that's, again, something testable, people can do studies on, and I think this provides for a theoretical foundation for saying, we better ask this question. We don't know. I don't know that storage is as much an issue in the way we usually use dry remedies as it is with the preparation procedure itself. Because I think the dry remedies may simply be sitting there ready to reactivate when we get them wet with saliva or they get into the body tissues.
Okay. And another question from another angle. One of the things some of us like to do is arm our clients with information they can give to their families or the skeptics around them. And, sometimes our clients struggle with our language of the vital force or the planes of the being. Are there things in this much more scientific language that you think we can pass on to our clients to help arm them?
That's a good question. I actually just finished drafting a paper which we'll be submitting for publication. It probably won't get published in the immediate future, but hopefully this year. That will eventually be the sort of the whole picture of what's going on. However, the paper on the nanoparticle nature of remedies is certainly available in the journal Homeopathy right now. And people can get access to it through interlibrary loan. Or if you know someone in an academic environment, they usually can get it at no cost. But you can actually buy that article if you wanted to and make it available to a doctor or whoever. then you have to point out to them that they need to be familiar with the nanoparticle literature, which is why I wrote that paper, because it pulls it together in a way that certainly no one in the nanoparticle science world is going to be doing.
Right. And what's the name of that article?
Oh, that's a good one.
Sorry, I didn't mean to put you on the spot.
Let me see if we can get all the way back here. Well, we're going to go, close your eyes.
Okay.
The author's name is Chikramane. That's the first author's name. I don't have the article right in front of me. It was published in 2010, and if you want, I can probably, let me just see here if I have
Well,
it.
with Chikramane in 2010, we ought to be able to find it, don't you think?
Yes, you should be able to find it in the journal Homeopathy, which is a Science Direct published by Elsevier. It's online. It's available. You know, as I said, it costs money to get articles from, unless you're a member of some academic institution that subscribes to the journal. The title of the article was Extreme Homeopathic Dilutions Retain Starting Materials, a Nanoparticulate Perspective, in the journal Homeopathy, 2010, volume 99, issue 4, and it's page numbers 231 to 242.
Okay, thank you for finding all of that. We should all be able to find it now. And
there are many other papers done by leading researchers in the field of basic science and homeopathy that tie in the hormesis part of the whole argument. So I'm not telling you anything that isn't in the literature. I'm just putting it all together.
Great. 2 more questions for you. What would you call a super low potency?
Super low potency, probably a 10M, 50M, 100M. Okay. Oh, I'm sorry. I'm looking at low in a different, no, low potency, 1X to 12X.
Okay.
But actually 24X. Super high, I would say on the other side, I don't know if there are nanoparticles there. My guess is that if it's a very good manufacturer who's prepared it properly, on the high potency side, they have their nanoparticles still there. But think about how many steps are involved in that. It certainly means they've had an awful lot more succussion going on. So that implies they're going to have a different kind of nanoparticle morphology in a 10M or a 50M than you're going to see at a 30C, or certainly at a 6C.
Right. And this question, I'm going to read off almost exactly the way it was submitted to me. The magnetic properties of homeopathics, meaning our nanoparticles, may explain the ability of Dr. Jacques Benveniste to record the signal of different homeopathics. Wouldn't this solve the issue of different manufacturers and different potencies not producing the same effect?
That's a good question. It would standardize. But think about, we don't know enough right now. I mean, this is really the very first of what could end up being decades of work to try to understand these things. It could be that the way we make remedies by hand is the best way, because we end up with irregular nanoparticles and clusters floating around, and that those are part of what makes it particularly effective as a remedy. You don't know that right now. So the more you standardize it, too soon, you might end up with a standardized signal that has some effect, but it may not have all the subtlety that you would see with a handmade remedy, for example. So it begins, to me, it begins to ask the question of, well, maybe those people who insist that the handmade remedies are better than the vortex ones are onto something. You know, I don't know. Mm-hmm. Just keep in mind, like in herbal medicine, there's been a big argument once they started to standardize the herb to one ingredient in the whole herb, they got the benefit of having a standardized product, but the people in herbalism said, wait a minute here, now you don't have the plant. Now you don't have the natural plant, and I'm not so sure that that one ingredient is the only thing going on here. In fact, I'm pretty sure it isn't. So that's the potential issue we could face if we leap the standardization too quickly. On the other hand, we can test this. We can do experiments and find out.
Okay. Well, I hope that I didn't miss anybody's question. I made an effort to get them all in. Thank you so much, Dr. Bell, for joining us and giving so freely your in-depth knowledge. We look forward to hearing more from you at the conference. I know you said this was like a little sampler of the more detailed presentation that you're going to give there, and we will all be looking forward to attending that. So I don't need to take up more of everybody's time. We're getting lots of thank yous typed in from all of our participants, and I want to thank all of you for joining us and giving us part of your evening tonight to listen to Dr. Bell. Thanks to everyone, and we look forward to seeing each other at the conference.
Great. Well, thanks again.
Sure. Good night.
Good night.